This is The Body's Compass with your host, Matt Sorensen. In this solo episode, Matt discusses the four main underlying drivers that he has clinically observed as to why many people with chronic pain are still suffering over the last 20 plus years. If you're listening to this and you are in pain, it would be helpful to keep an open mind and be willing to explore at least one of these four drivers a little further. Listen out for Matt's brand new online community, where he offers group coaching calls to anyone looking for answers to their questions. Now let's jump straight in.
Welcome back to The Body's Compass. I'm Matt Sorensen, and today just flying solo, just me, a microphone, Cedric, and something I've been wanting to talk about for a bit of time now, and that is, why does pain keep coming back? So I've been working with bodies for over 2 decades now, and the question I hear more than any from clients, practitioners, from people who have essentially tried everything and none of it's really working, is some kind of version of, I've done chiro, physio, doctor, naturopath, I've had all the massages, even taken the medication, and it works for a while. Then it comes back. Why does it always come back? So I want to hopefully answer that today for some people properly, just not with a quick fix or supplement recommendation, but with a real picture of what's actually going on when pain keeps returning despite everything you've done and keep doing. Because here's what I know after 20 plus years of sitting with someone with some people with some of the most complex cases. Pain isn't random, nor is it bad luck. It's almost certainly not coming from where you think it is. So let's dive in. Firstly, we talk about the symptom trap. The first thing I want to talk about is when I talk about the symptom trap, and almost every person who walks through this door has been caught in that trap at some point in time. So here's how it works. You have pain somewhere. Let's say your lower back. So you go and get your lower back treated. It feels better. A few days, a week later, it's back. So you go again. It feels better. A week later, it's back again. So if that sounds familiar, the problem isn't the treatment necessarily. The problem is the question being asked. The question being asked is either, how do we get rid of this pain, or why are we not healing? When that question why that question needs to be asked is, why is the pain there in the first place? So think about it like a fire alarm going off in your house. You could climb up and pull the battery out and the noise will stop, but the fire's still going. The alarm was never the problem. It was the information. It was the messenger. Pain's the same. Pain is your body's alarm system. And when we keep silencing the alarm, i.e. isolated medications, isolated treatments, isolated exercises, we keep doing that without finding the fire, the alarm is just going to keep going off because the fire is still there. This fire analogy could be inflammation as an example. So most treatment is aimed at where the pain is, not where it's coming from. And that distinction, that single distinction, is the difference between temporary relief and actually getting to the root cause and healing the thing. So the 4 hidden drivers that I've kind of narrowed it down to. If the pain isn't coming from where it seems to be, where is it coming from? Now, in my experience, I've drawn on the work from, as you all know, Paul Chek, Burrell Institute, Carolyn Miss, Carl Jung, studied the chakra systems, DeMartini, all of these different systems intertwined, and we all get information from everywhere and we synthesize it in our own way and do what we can with it. And 20 odd years later of clinical practice, I've arrived at this. There are typically 4 hidden drivers that keep pain cycling in the body. And most conventional treatment addresses one or really none of them. So let me just walk you through each one and let's just see what you resonate to. We all resonate to different things. This is just what I've found over the last 20 odd years, and I've found the body is consistent. So driver 1, visceral tension. This one surprises people the most. Your organs are not passive passengers in the body. They move, they breathe, they have their own rhythm, i.e. motility. And when they become restricted through inflammation, poor diet, stress, surgery, which can create a lot of scar tissue, or simply the accumulation on life, they pull on the surrounding structures. Now, as you can see on my model Cedric here, your liver sits right under the rib cage at the right, just here. It's a big organ made of black tape. If your liver looks like that, get help now. You can also see the diaphragm right on top of the liver. Now, if you have a liver problem, there's a great chance that you have a diaphragm problem. The phrenic nerve comes from C345, goes through down here. It is the only motor nerve that innervates the diaphragm. So it's the movement nerve that makes the diaphragm move. The liver will communicate to the right shoulder capsule via the phrenic nerve. A lot of the time, tensions in life gets picked up by the phrenic nerve and it communicates to the capsule. If the diaphragm's too busy breathing, then it will dump excess tension. That tension gets picked up by the phrenic nerve and goes elsewhere. A lot of the time, a liver issue will create a right shoulder issue. It can create also right temporal headaches. It can create cranial base restrictions. It can create sacroiliac joint issues at the back due to hepatic regions here, due to hepatic congestion. So all of these symptoms effectively stem from the liver. Now, it's not always the liver, obviously, but then people are going to go get their sacroiliac joint tested or worked on. They're going to get their shoulder tested or worked on. They're going to get their headaches sorted, etc., etc. But no amount of these treatments are going to be a permanent fix because the shoulder, the sacroiliac in this example, that's not where the problem is. It's the liver. Your psoas muscle, which attaches onto the discs of the lumbar spine. It's a deep hip flexor that connects your spine to the lower body. Some say it's the bridge between torso, upper body, and lower body. It runs right from the spine down into the lesser trochanter, right here. It also runs right alongside of your digestive organs. In fact, the kidneys sit right on top of the psoas, and they're connected by the same renal fascia. So when your gut is inflamed or restricted, the psoas has to guard that. That's what the musculoskeletal system is there for, to protect the visceral system. So the psoas will either contract and stay locked on, or it's going to completely flop and go either taut or just switch off. When it contracts, that contracted psoas can create lower back pain, hip pain, pelvic tension, pelvic torsion. That looks muscular, but it's actually visceral. So this is largely by the work of Jean-Pierre Barral, a French osteopath who mapped these patterns of the organs into the musculoskeletal system with extraordinary precision. And unfortunately, once you see it, you cannot unsee it. the body is not a collection of separate parts. It's one continuous interconnected system. Paul Chet calls it a cybernetic system, a system of systems. And pain in one area is almost always being driven by restriction somewhere else in the body entirely. Driver 2, nervous system dysregulation. So here's something most people don't know, or they don't realize, or they kind of ignore. Once you've been in pain long enough, your nervous system learns to it. We operate on what's called either the MENS system, MENS, minimal electrical neuromuscular stimulation, which means the body is extremely effective at conserving energy. The brain and nervous system will always take the path of least resistance. And we also operate on the SAID principle, SAID, specific adaptation to impose demands. So if I'm sitting like this all day with a hunched posture, my nervous system will be responsive to the specific adaptation of this imposed demand. Now, when we're talking about pain, pain is processed and interpreted by the brain and the nervous system. And the nervous system is a pattern recognition machine. It's constantly learning, it's constantly adapting. And over time, it can begin to generate pain signals even when the original injury or restriction has been healed, because it has learned that this is what it does in this situation. Just a quick side note on what that looks like. Here we have a little diagram. If you're watching the video of this, this is L2 in the lumbar spine. So if you go to your bottom ribs and go, say, 2 inches down, that's roughly where L2 sits, or about an inch above your belly button. At L2, we have a recurrent nerve called the recurrent nerve of Luxor. In this recurrent nerve, you can see here it comes around and innervates the disc and the facets, all from multiple angles from the one nerve. From this nerve ganglia, it also has connections into the viscera, the organs. So remember, it's a bidirectional street, meaning the organs can influence this segment and the segment can influence the organs. But the signal from the organ to the spine is like a double-lane highway. The signal from the spine to the organ is more like kind of like a goat trail in a way. It's also connected to the sympathetic chain ganglia. So the sympathetic trunk runs down alongside to L2. Think of that as a fast lane highway up to the brain. Now, if there's issues here that get picked up by this nerve, it goes through the internuncial pull at the spinal cord going up into the spinothalamic tract by the spinal cord. It then goes into the thalamus, which is the part of the brain that processes most things. From the thalamus, that goes to the relay, so it decides where to send it. Then it goes into the somatosensory cortex part of the brain, which is the locator. So it's the part of the brain that says, oh, it's my shoulder, oh, it's my lower back, or wherever it is. From there, it goes into the amygdala, or the anterior cingulate cortex, which is your response system part of the brain. The amygdala is part of the limbic system, so it actually creates an emotional response. So based on that, pain is technically an emotion, rarely a good one. Then it goes deeper into the brain. Then it goes more prefrontal cortex, which gives the pain meaning. In other words, why has this happened? What is going on? It starts to problem solve. From the prefrontal cortex, it then goes into the insular cortex, which is where the brain decides, okay, we need to action something. So in other words, an action might be a limp after stepping on a nail. So that's like an action item from the insular cortex. The insular cortex to the brain is what the middle point on a seesaw is. It's that bouncy bit in the middle. It's always trying to create that balance. From the insular cortex, where it decides what action it takes, it then dumps excess load into the tissues. What tissues? That's really dependent on the person. It's dependent on the person's individual training age, how healthy they are, where there's current inflammation, where there's dehydration, how they move, are they fatigued, etc., etc. So the nervous system makes these decisions in milliseconds. And this is why people can have structural changes on an MRI, let's say a bulging disc, some degeneration. Some people feel no pain at all. And other people with clean scans can also be in agony. The scan tells you what the structure looks like. It doesn't tell you what the nervous system is really doing with that information. When people present to you as part of their posture, the way they hold themselves, their emotional state, the words they use, that's the information that the nervous system is giving essentially to the world. So a nervous system stuck in chronic stress, in what we call sympathetic dominance or fight or flight, keeps muscles guarded, keeps them tense, it keeps tissues inflamed over and over again, and it keeps the pain alarm firing long after the original trigger has been pulled. So to break the cycle of recurring pain, you have to work with the nervous system itself, not just the tissue. Driver 3, the emotional and stress patterns. Now, this is the one people are sometimes most resistant to, and I totally get it, because for a long time we've been told that, our pain has an emotional component and it's not real. It means it's in our head, we've made it up. So I want to be very clear for those people. It is not in your head, it is in your body. The body will store unresolved stress, grief, trauma, emotional tension in the tissues, specifically the fascia surrounding the organ and in the nervous system, particularly the myelin sheath surrounding the nerve, particularly the fascia surrounding the organ. And I remember Jean-Pierre Barral saying, and there's a bit of debate amongst practitioners at the moment whether we actually do or don't store emotions in the body. And Barral, who's been working with this stuff for over 60 years now, said tissues are either 1% emotionally affected or 99% emotionally affected. Now, if it's the 1% affected, then it's likely either going to be stored in the brain or the astral body. The astral body is about 30 centimeters away from the physical body. We can actually palpate our physical with our hand. If you bring your hand up about 10 centimeters, that's where energetically our physical body ends and it starts to merge with the astral body. Now, we all know that we are affected by everything in our environment. Well, before we get to what we call the environment, it first passes the astral body, which is about 30 centimeters away from us. And you think, well, that's crap, that can't influence me. Think about an energetic thorn in your side all day, every day. That is what a stored emotion looks like that. So it's not a metaphor, and it's actually been measured. It's a measurable physiological reality. When we experience something overwhelming, physically, emotionally, and we don't fully process it, the body holds it. It keeps the muscles braced in case for the attack. It keeps the diaphragm tight. It keeps the gut guarded. And over time, that held tension becomes structural. First it was functional, then it becomes structural. It becomes the architecture of how the body organizes itself. Remember, the body's priority is survival. but it's hard to go from survival to thrivival when you're so tense. You can't, nothing can really flow. So chronic pain is often the body's way of holding something that hasn't been given the space or the time to move through. And no amount of physical treatment alone will permanently resolve pain that has an emotional driver underneath it. Now, this doesn't mean that therapy instead of body work, won't work. It means you require both. It means treating the whole person, body, mind, not just the symptom. Driver 4, movement compensation. In the check system, we go through a series of physical assessments. We just taught level 1. In level 1, there's 10 assessments that we go through postural measurements and core assessment. In level 2, there's another 36 assessments through spinal mechanics and movement analysis. In level 3, I've forgotten now, there's another 20 or 30. In level 4, there's no less than 70 or 80 further tests that we do. These assessments are really critical, and some people think they're too much. However, I tell patients and students it's really good to have something objective. Someone's going to come in with something subjective, but if we can give them something objective, saying this is the curve, this is the angle, this is what the joint's doing, etc., then it gives them something to work from. It gives them a platform and gives them something to navigate with and through. And to the people that think, oh, it's too much, well, I tell students all the time, there is going to come someone through your door one day and you're going to pull out every single assessment you know and more, and you'll still have no idea. The body is just too dynamic and too complex just to say that's what it is straight off the bat. That's why we do these series of different assessments. The assessments can be length, tension, relationships, posture, core assessment, joint mechanics, joint range of motion, movement mechanics, movement analysis, neurological testing. We do eye testing, jaw testing, teeth, upper neck, sacroiliac. We do everything. So the 4th driver is, as every movement practitioner understands, but it's worth naming clearly. When something hurts, the body's going to compensate. It finds a workaround. It offloads the painful area and recruits other structures to take the load. Everyone's got their own subconscious strategy. In the short term, when you think about it, it's brilliant. It's the body protecting itself. In the long term, it becomes the problem. Because the compensation pattern becomes habitual. The nervous system learns the new movement strategy. The muscles involved get overworked and tight. The joints involved get compressed, and eventually the compensation site starts to hurt. And now you have pain in a new place on top of the original problem with no clear connection between them. So what will happen, you develop this pattern, this motor engram. So the brain says, okay, well, this is how we need to move to avoid the pain. In this respect, the brain is quite lazy. It'll keep firing new pathways to avoid the pain. This creates, let's say, ugly looking postures and movement patterns. From that, we get uneven loading on joints. So it might have started in the foot, but then it ends up in the neck. They don't seem related to most people, but just through spinal mechanics and kinetic chain and fascial slings, etc., they are very, very connected. This is why someone with a long history of left knee pain develops right hip pain, why someone with a history of ankle injuries ends up with lower back problems years later. The body is incredibly clever at protecting itself. And sometimes that protection creates its own chain of consequences. So treating the hip without understanding the knees or the shoulder, treating the back without understanding the ankle or the knee keeps the cycle going indefinitely. So what actually breaks this cycle? So those are the four hidden drivers: visceral tension, nervous system dysregulation, emotional patterns, and movement compensation. The reason pain keeps coming back for most people is that the treatment they're receiving is addressing maybe one of these at best, sometimes none. So what actually breaks the cycle is a whole person, a holistic person approach that assesses and addresses all of these four drivers simultaneously. And this is why I've spent 20 odd years developing my own practice, what I'm very, very slowly calling the Sorensen Method, which combines advanced manual therapy from Boreal Institute with the visceral manipulation, the neural manipulation, the vascular work, the joint manual articulation, and with functional movement and rehab and coaching from the Czech Institute that addresses the nervous system, the emotional patterns, and lifestyle factors that keep the body stuck in most cases. So it's not about doing more treatments. It's about asking better questions. Where is the pain actually coming from? What is the body trying to communicate to you? It is talking to us 24/7. What needs to change? Not just in the tissue, but in the way this person moves, eats, sleeps, breathes, and processes stress. Stress itself is just a perception. In the DeMartini method, he talks about, instead of saying a stressful event, just say event, because the event by itself is neutral. We come along with our own programmed beliefs. We put our biases on it, and we create it to be either positive or negative. The event itself is neutral. We put our biases onto it. Therefore, we have a charge to that particular event. So it's about balancing those polarities. To the degree that we focus on one angle of that polarity, we're unconscious of the other polarity. So therefore, we have a charge and we don't have complete awareness of the person, place, thing, event that happened. So therefore, we don't see the bigger picture of that event. We can either be a victim of our past or the master of our own destiny. So this is breadcrumb of what we can actually do for this pattern to actually shift. And that's essentially the work. And when it's done properly, the results are not temporary relief. They are genuine. It's lasting change. So what can you do right now? So I want to leave you with some practical things that you can take away from this episode and apply immediately, regardless of, where you are in your little journey. So first, we need to expand the map just a little bit. Next time you notice pain, don't just focus on where it is. Notice what else feels tight, what else feels restricted or uncomfortable in your body. If you can think of a stressful event, think of the event, hold the thought, take a breath, and feel where you feel it in your system. So as an example, you may have had a fight with your partner over the last few days, and it's really sitting with you. Or maybe you had something happen to you as a kid. Think about that event, hold the energy of that thought, and feel what's buzzing in your body. Feel where it gets tight, feels restricted. Then you can look at the tissues involved in that area and then start going from there. So, for example, your right shoulder and your liver, your lower back and your gut, your neck and your jaw. Start connecting the dots that you might have been treating previously as separate. Second, track the triggers. Keep a simple note on your phone or write it down. When does the pain get worse? Is it after a stressful day? After certain foods? Is it after poor sleep? After standing too much, sitting for long periods? These patterns are clues. They point towards the visceral system, the nervous system, and lifestyle drivers that are constantly feeding the pain, just like in this loop. Third, ask your practitioner some questions. Next time you see your doctor, GP, chiropractor, physio, whoever you're seeing, ask them, are you treating the site of my pain or are you trying to find the source? Now, a practitioner who's quite in their ego will get quite defensive. And I know this because I used to be that. An open practitioner with, I want to say, a practitioner who's open-minded and welcomes the challenge will actually really welcome that question. And it will also tell you a lot about how they think as a practitioner. Fourth, consider the emotional layer. This one takes courage, but I would invite you to gently ask yourself, is there something I've been carrying that hasn't had space to move? Not necessarily psychoanalyzing yourself, just to open the door a little. The body will often speak loudest when everything else has been ignored. So as an example, you'll notice that you'll go about your day, you'll do your things, and the pain might be quiet. You come home, things have kind of settled down, you're getting ready for bed, that's where the pain comes up. Or it's fine throughout the day as you keep moving, and then you go to sleep, and then you wake up at 2 o'clock, there's the pain. You might even sleep throughout the night, and you wake up, there's the pain. Sometimes it's the opposite. You could do all that and be fine. And then you start work or start moving, there's the pain. These are all clues. A lot of people won't look for things they can't see. Just as an example, people who develop the pain or the pain becomes more kind of an onset have a lot of tension in the venous system. The venous system is the veins. At any one time, we carry up to 75% of our total blood volume in the venous system, meaning that 75% of our blood isn't in the periphery, it's going back to the heart. Now, the venous system is there to protect the nervous system. When the venous system gets congested, gets full, not necessarily full, but when it gets congested, these vessels have to widen and they actually irritate the nervous system. So you get this dull, kind of achy sensation, but it happens more when you're at rest. So we need more flow, indication of an energy blocking. Candace Pert defined emotions as energy in motion. So we have an energy blockage. You can see how that affects the venous flow, and, shit gets weird from there. So I want to come back to where and how this kind of started. I often record these solo episodes because I see a pattern in clinic, and if it happens enough, I kind of, in my own way, see that as a sign, if you will, to share it with you. So I had a client come in with all kinds of issues. And long story short, client, the one who tried everything, chiro, massage, physio, medication, years and years and years of treatment, years and years of temporary relief, followed by the same pain returning. Well, we had to sit down and have a very honest conversation, firstly, about essentially these 4 things I've just shared with you today: the emotion, the visceral tension, the nervous system regulation, dysregulation, the emotional holding that was going on, and then the patterns that emerged out of that, and of course the movement compensation from there. So when we finally sat down together and did a proper assessment, a proper treatment plan, proper program, we found a restricted liver referring into the right shoulder, a nervous system stuck in chronic sympathetic dominance from just years of hyperceptive stress, a movement pattern compensation for an old ankle injury from 20 years earlier. And underneath all of it, a level of unprocessed grief that had been living in the body since a significant loss before she was 15. None of those things had ever been looked at, not one. And within about 6 sessions, not 66, the pain had shifted in a way that she hasn't shifted in years. It did require a lot of tears from her, but we celebrated that as well. And not because we did anything miraculous, but because we finally asked the right questions. We finally went to the source of that. So your pain isn't random, and it is not permanent, and it is not who you are. It is simply a signal, and once you learn to read it, everything changes. Once you learn to read it, then you get really good at it. Once you get really good at it, people will come to you. As I said to my students last week, the universe knows when you've done a class, and everything you've learnt, you're going to attract people who need the things that you learnt in the class. It's no different inside or outside the clinic.
Episode of The Body's Compass
you
with
attract
Matt Sorensen.
what you are.
If any of this episode resonates, share it
need
with someone. It might help. If it helped you, come back.
Wild world.
Before you go, please take a minute to leave a 5-star rating and a warm review. It helps people find the show. For those interested, Matt has created a brand new online
purpose of
community
this
called The Inner
episode is
Circle,
to
where you
really
can
get someone to resonate with this.
coaching
I
calls.
haven't thought about that. So maybe I'll look into that a little bit more.
Until
if I get
next
that
time,
reaction, my job here is done. So thank you for listening to this episode. And if this episode resonated with you, please share it with someone who needs to hear it. And if you feel like giving a great review, then I'm not going to say no to that either. So wherever you listen, it genuinely helps more people find the show. But if you want to go deeper, head to healhub.net and find out about working potentially with me or another Czech professional. Instagram at The Body's Compass. I am starting a new membership site called The Inner Circle. So check out healhub.net/The Inner Circle. And we're going to be doing fortnightly calls with me every fortnight, asking questions and me giving really cool answers. But you can post in the forum and we'll keep in touch that way. You'll have direct access to me and we get to hang out every fortnight. So thanks for hanging in there with me, guys. Remember, listen to your body. Jean-Pierre Barral says the tissues know what they want. They know how to release. The body knows what it wants. The body knows how to release. You do have a conscious decision in any given moment to be the victim of your past or the master of your destiny. But your destiny always will change dependent on whether you decide to be victim or victor. But we have that choice in any given moment. That's why we have free will. Use it wisely.
That's a wrap for this solo episode of The Body's Compass with Matt Sorensen. If any of this episode resonates, share it with someone. It might help. If it helped you, come back. Before you go, please take a minute to leave a 5-star rating and a warm review. It helps people find the show. For those interested, Matt has created a brand new online community called The Inner Circle, where you can get direct access to Matt through coaching calls. Visit healhub.net/The Inner Circle. Until next time,